Newsday continues here on One News Now. I'm Riza Diaz. The Health Department reports over 3,400 new COVID-19 cases, making the second consecutive day this year with above 3,000 infections. Today's figure is also the highest since October 12 last year. That brings the country's total caseload to more than 591,000, around 43,000 of which are still active. Over 95% are mild and asymptomatic cases. The virus claimed, meanwhile, the lives of 42 more patients in the past 24 hours, bringing the death toll to more than 12,400. Total recoveries are now at 535,000, with over 160 new survivors in the past 24 hours. To help us make sense of these numbers, Professor Guido David of the DOTr research team is joining us live on the phone. Sir, good evening.
Yes, good evening, Riza.
Sir, new COVID cases today are at the highest since October last year. What does this tell us about our current COVID situation?
Well, it tells us that our current situation in the NCR is definitely not good. We've been tracking the increase, and well, it's around in line with the trajectory, but it may be accelerating. The fact that we're at more than 3,000 cases for 2 days in a row means that well, I haven't seen the breakdown of today's numbers, but it means that it's probably spreading to more and more areas in the NCR, and that is definitely not good because when we look at the trend, well, we see that it's in Pasay, there's parts of Manila, Parañaque, Taguig, Makati, etc., that are having increases, but they're not yet at that level. But it could be that some of these barangays will soon start to have big increases as well.
Sir, given the current uptrend and with the threat of new variants spreading, just how ready are our hospitals at this point?
Well, I can't speak for the hospitals themselves because they have their directors to comment on that, and also the Department of Health. Well, what we do know is that hospitals have scaled up their capacity, so they've added hospital beds. And I think the frontliners are, ready for this because, we had that increase back in August, and I think they've learned how to, adjust to the COVID. But then again, as we know, the variant is a significant threat right now, and that could, we're not sure yet how that will change hospital care response to the variant, especially since, we may not be that familiar with the variant yet. I mean, I know it's still the same coronavirus, but this variant is a lot more infectious.
Mm-hmm. So what can we do, sir, to brace for the impact of these variants?
I'm sorry?
What can we do since the number is, of course, increasing and, these variants could be more infectious? What can we do to brace for the impact?
Yes. Well, right now we're trying localized lockdowns. I believe that the government does not want to go back to, like an NCR-wide lockdown for economic reasons. Well, we hope the localized lockdowns will work. They've already instituted localized lockdowns in Pasay, and I think Navotas is under a localized lockdown. But right now it may not be working as well as we hope it would because it's slowly spreading to the other barangays and other LGUs. I mean, this will have to confirm if it is indeed spreading to other barangays. But right now, I mean, when we last checked the data, it hasn't really. Well, I mean, there are some places like Marikina where it's not really increasing that much. I mean, Marikina and I think Muntinlupa and Las Piñas. But it could soon be the case that these other LGUs will be affected as well. So what's important is for us to remind people, to implement these health practices more strictly. And in fact, just today I got a note from someone to, they're spreading the word that let's treat this like it's ECQ in the sense that for individuals, let's approach this with the mindset that we should be very, very careful when going out. Risks are high for infection in certain areas, and that's why we give advisories on which areas these are. But we don't know now. I mean, it could be anywhere. So let's be very, very careful when going out. Let's limit the time spent outdoors and not have to go out if it's not so necessary. So let's, in effect, let's limit the time spent outdoors for leisure activities and, restrict it to work-related activities.
Professor, can you give us a projection or perhaps a timeline on how soon we are likely to see vaccines' effect on transmission?
Well, I don't have the numbers for the vaccine rollout. We don't know yet when a sufficient number of vaccines will arrive. Right now, we're looking at maybe a maximum of maybe 1 million. Maybe we'll get another million. But these are also being distributed or spread to other areas in the Philippines, not just NCR. And right now our priority is to get maybe health workers vaccinated, and then maybe economic frontliners and uniformed personnel. The effect on the numbers will not be significant at this time, even when we vaccinate a few million people, because what we see in other countries is that they've vaccinated maybe at least 25% of their population before they see a significant decrease in the number of new cases. So before we get to 25%, even if it's just NCR, 25% would be more than 3 million people. I don't know when to get 3 million vaccines in the NCR, so we'll just have to see. Depends on the rollout.
Well, thank you, sir, for your time. That was Professor Guido David of the DOTr Research Group. We'll be back with more stories after the break. Keep it here on One News. Losses due to the ongoing health crisis. Let's get more details from Gerald de la Peña. He's reporting live on the line. Gerard, what's the latest from the province?
Well, Riza, the Public Transportation Department have officially opened a new project here in Puerto Princesa. Officials view this as very timely now that the COVID-19 vaccines have also reached the shores of Palawan. The DPWH and the DOTr led the inauguration of the Puerto Princesa cruise port and facilities earlier today. The 3.5 billion peso project is aimed at welcoming international tourists from cruise companies. But this is just the partial opening, as the government has yet to finish the remaining 20% of the project, which is expected to be completed by August this year. The facility can accommodate up to 25,000 passengers at a time. Eventually, the facility will also house commercial establishments. This is expected to give tourism a boost, which is one of the province's primary sources of income. Puerto Princesa is also the gateway to other tourist destinations such as El Nido, San Vicente, and Taytay. In addition to this, Palawan is being primed as a center for convention. Local officials say the project is very timely as the national government brought more than 5,000 doses of Sinovac vaccines here yesterday. Puerto Princesa Mayor Lucilo Bayron said This will be a big help for the local economy, which was severely affected by the pandemic. Riza, the provincial government of Puerto Princesa says the vaccines will be distributed to hospitals in the northern and southern portions of the province, as well as in Culion. Riza.
Thank you for that report. That was Gerald De La Peña. Now, here are other stories we're keeping our eyes on. Senator Win Gatchalian says some 433 municipalities with zero COVID-19 cases are being considered for the pilot testing of face-to-face classes. Gatchalian, however, notes that parents and teachers will not be forced to join the program if they are against it. The Senate has adopted a resolution calling on the Education Department to immediately pursue the pilot run of in-person learning. The camp of Christine Dacera is questioning the late submission of lab test results to the Makati City Prosecutor's Office. They point out that the results for semen and drug tests came out mid-February, but the motion was only filed on March 1. Despite this, they welcome the findings on the presence of drugs as this implies the accountability of the respondents. And free LRT2 rides will be given to female passengers on Monday in celebration of International Women's Day. In a Facebook post, the Light Rail Transit Authority announced that women passengers may ride the LRT Line 2 for free from 7 in the morning till 9 in the morning and 5 p.m. to 7 p.m. The day is marked to celebrate the women's achievements and encourage the public to rally for gender equality. Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.